Hello, this is Dr. Joan St. Ange, presenting faculty development for the NextGenMD, a 360-degree approach. I would like to acknowledge my fellow faculty who worked on this project throughout the months of May through August: Marianne Benitez, Kaplan, Edwin Merced, and Dave Lewis. The objectives of this session are that the participants can list the preparatory steps needed for an online faculty development series, to allow them to articulate the Phase 1 faculty roles identified in the NextGen curriculum. Using a 360-degree approach, participants should be able to outline how to present faculty development for a major curricular change. They should be able to list the successful aspects of this faculty development program and recognize the challenges of online faculty development. As some background, the NextGenMD is a major curricular reform at the Miller School of Medicine. Started in 2017, it was actually launched in August of 2020. Its emphasis is on student-driven learning and active learning modalities. Less lecture-based, more hands-on learning, case-based discussions, and an earlier transition to the clinical clerkships. Case-based collaborative learning is the major modality used in Phase 1, and all of these modalities are new, relatively, for many of the faculty, including the new roles that the NextGen provided. This is an overview of the NextGenMD, where you see our why statement at the Miller School: empowering to transform and inspiring to serve. There's a pre-clerkship phase, which we are going to focus on mostly today, and that was the focus of our faculty development as well. This is called Phase 1. That's followed by, of course, Phase 2, or the clerkship phase, followed by the advanced phase, or the Phase 3 of the curriculum, where the students will go on to pursue specific pathways and develop their capstone project. Throughout the time, it's interesting to note that medicine as a profession is a longitudinal theme, which focuses on clinical skills, professionalism, communication skills, among other topics. And then also all students engage in a scholarly concentration. This is an idea of how the Phase 1B and 1C mornings will roll out over the entire phase. There'll be a weekly assessment in the first part of the Monday morning, followed by a clinical correlate, followed by a case-based collaborative learning session. There'll be seminars, self-directed learning, opportunities for office hours, and of course, an emphasis throughout the week on self-directed learning of the students. It's important to know that these case-based collaborative learning sessions are small group sessions led by a facilitator who will monitor the students' progress and guide them, not teach them like they would in lecture, but guide them to develop the learning objectives and the information required to advance in the Phase 1 part of the curriculum. This is an example of how Phase 1 rolled out. In August, the students came together for a 2-week Inspire and Empower session of the medicine as a profession and an introduction to the medical profession. Foundations and the Well Patient are Phase 1B, where the basic foundational sciences are taught, and the students then advance on to examining human disease through symptoms such as cough, fever, chest pain, shortness of breath, etc. All of this is developed through these individual units that were developed by the faculty. And as, of course, medicine as a profession continues throughout, as well as different opportunities for learning. All of this was in the process of being developed since 2017, as I mentioned. The unit builders and the faculty were engaged consistently through academic year 2018, 19, and 19 and 20, focusing on the launch of the curriculum in August of 2020. And then, as everyone knows, COVID struck. And our challenge was, how were we going to present this information to our faculty in an online platform? All of the work that was being done on the curriculum development was now being done online, and we were addressing how to present this to the students in an online format, which added a few more issues to our faculty development sessions. On this side, the faculty roles and participants in our faculty development sessions are listed. First, we have the unit builders, whose responsibility was creating those case-based units, the course objectives, the case objectives, aligning the curriculum as it rolled out. They had been working together over the course of the last academic year, receiving their own faculty development, as well as working as a unit to roll out the Phase 1B morning sessions. There were the domain directors, whose responsibility was to assure the objectives are being met within each section of Phase 1B and Phase 1C within their specific domain, such as the inflammatory cascade or skin and soft tissue disease. There were the discipline directors, whose role was to assure that the objectives of each of the disciplines were being met in Phase 1B and Phase 1C, such as in pharmacology, in anatomy, in physiology, and in biochemistry. And finally, there were the facilitators, the group of faculty whose responsibility was to engage with the students in a small group session, to make sure that the students learned the objectives, to actively engage with the material, to resolve conflict, and to encourage students' learning throughout the NextGen curriculum. All of these faculty were important components of a successful NextGen curriculum, and they all participated in our faculty development sessions. So we got together and started planning, and we said, okay, what's the timeline? We wanted to reinforce some of the major areas of faculty development, not too distantly from the launch of the curriculum, but also have enough time to develop all of the areas that we thought were needed. We wanted to focus on all faculty involved in Phase 1B and Phase 1C development, including those roles that I just mentioned. We questioned, in this pandemic era, how many sessions we would be able to offer to the faculty so that they could engage in the material. When, what days of the week, what times of the day, what topics did we need to really hone in on? And at the end of the day, who should participate in presenting those topics, and also who should participate in each specific section, which reviewed a specific area of faculty development. So our team got together and planned an 8 to 9 week course, and I will review that with you. So I mentioned the 9th week, and we'll get to that in a minute, but it was truly an 8-week course where we invited all faculty to participate. We decided to schedule 2 meetings during the week, one on Wednesday evening from 5 to 6:30, and the other a repeat Thursday from 12 to 1:30. We created a course in Blackboard called the Miller School of Medicine Faculty Development, and enrolled all of the faculty in that course. The sessions, we decided, could be no shorter than 90 minutes and no longer than 90 minutes because we would lose our audience. And all of the sessions were recorded and presented on Zoom, which was something new for all of us. We decided to focus on the active learning modalities that all of our students would be engaged in. So we provided pre-learning resources for each session. When the faculty gathered for each 90-minute session, we had an individual readiness assessment using various features that were available through Zoom, such as polling. We also used a Qualtrics format as well. We had a didactic session. We tried to make this short to make sure that this was an engaging session and not just one in which faculty could sit back and listen. Remember, we were developing facilitators, which were the guide on the side, rather than lecturers, which were commonly referred to as the sage on the stage. We didn't want to be the sage on the stage, so we tried to make all of these things short, used various features to make it interactive via the chat, opening up the sessions, using case-based learning, etc. And then, of course, we needed some time for questions for each session. So the title of this talk is a 360-degree approach. And when we looked at the topics we needed to present, we decided that we needed to focus on the total learning environment, not only what we were teaching, how we were going to be teaching it, who were we teaching, who were we as teachers, and then circle back in terms of reviewing the what and the how. So these are some of the topics that we reviewed. First, what? We got together in our first session and described, as I did a few slides ago, the overview of the curriculum so that the unit builders knew where they were focused in the morning sessions. They knew what the medicine as a profession group was doing in the afternoons, so that they could see visually how this was all coming together. The facilitators also needed to understand how those morning sessions were going to correlate with the afternoon sessions. So that was where we started, with an overview of Phase 1B as an example, with the directors of Phase 1B actively engaging and setting up the different roles of individuals. The next session really focused on how to teach and what learning modalities we were going to be using. We focused a lot on active learning strategies. We went through the underlying reasons for kind of flipping the classroom and making the students become more actively engaged with the material. We talked about pre-work, which was a part of what every faculty member had to do before they started each session. And we demonstrated various ways of doing individual readiness assessments to kind of test the audience and see exactly how much of that pre-work was understood. Some of our most successful sessions were the who. Who are you teaching and who are you? We had an overview of the general class makeup for those individuals who were new into the Miller School, or actually just were curious about who was coming into our class in this new next-gen curriculum. We talked about generational differences in learning and expectations, and we used case-based approach to this. A lot of discussion on different approaches that different generations take, and it was very well received. Our next session was actually really important, not only for our faculty during the faculty development sessions, but also in general, because we were in a summer during which we had witnessed the murder of George Floyd. Many of the racial justice issues were being brought up in the news and in our environment, and we really wanted to focus on identifying who our faculty are, who allow them to think about what they brought into the classroom. We had a discussion, very lively discussion on implicit bias and microaggressions, and then also on facilitation strategies and how individuals within a small group setting can resolve conflict, how the facilitator what role that facilitator plays in that conflict resolution, And I can tell you that these were some of the most well-regarded sessions. We focused on how do I do so many of the things that we were talking about. So assessment strategies, how do I know the students are learning? And then also, again, regrouped and reinforced those facilitation strategies again and again. And throughout the sessions, the question was, how do I really do this? Not just the content presentation, but how are the faculty going to present and engage with students via the Zoom platform? How are they using Blackboard? What tools would be available to them? And many of them, if you look at the spectrum of Zoom usage, many of them had been actively engaged in presenting lectures and teaching on Zoom, but some of them had not done any and were really novices. So we had teaching with technology became a very, very big focus toward the end of our faculty development series. And we needed to make sure that in kind of a competency assessment approach, that the faculty had opportunities to engage actively with the information that teaching with technology requires. So we developed a number of different ways to not only engage the faculty, but also make sure that they had some hands-on experience with this. So what were some of the highlights? As I mentioned, teaching with technology became a major focus of our faculty development sessions. And as you roll out faculty development over 8 weeks, I think one of the take-home messages that we had was that we had to reassess what we were teaching and change our plan kind of midstream. The faculty wanted more sessions on teaching with technology, so we needed to develop them and make them engaging, which is very difficult to do in terms of the various platforms available to us. We focused on how to use Blackboard and went through some of the various components of it, and also how to use Zoom. And doing this online via Zoom was, I have to say, one of the more challenging areas that we addressed. However, both Dave Lewis and Edwin Merced were phenomenal in terms of their approach and their use of the technology to make sure our faculty understood exactly how to do this. Teaching on Blackboard and really focusing on what the individuals needed to know, we wanted to make sure that all faculty knew how to communicate with the students. So we had them practice on using email through Blackboard and sending announcements through to the students' email. We used the announcements feature. We also had them set up queries and answer queries on the discussion board. And we introduced them to the gradebook feature of Blackboard. It was not something that we had them use in terms of posting grades, etc., but we wanted to make sure that they knew that the gradebook exists, that there were things to be graded and assessed, and where to find that feature, how to use it, and also who was available to assist you if you had any questions as the faculty proceeded through each course. Teaching Zoom on Zoom is very, very difficult. Our first session, we used the Blackboard Collaborate, and it was well received, but the faculty wanted more hands-on practice. And using Zoom, it's hard to get people engaged within a Zoom session on the various components. So this took a little legwork ahead of time to set up sessions that the students or faculty, that is, could actually engage and use the breakout rooms use the polling feature and understand the importance of the single sign-on focus in terms of how people could go in and out of the Zoom sessions that were created. We had them share their screen and also practice using the whiteboard as well as saving the whiteboard to make sure that they understood some of the features that they could use. And this actually, even though it was a challenge to set up, it was very well done, and the faculty did appreciate the opportunity to practice with their peers and engage with them to see what they knew and what they didn't know before the curriculum rolled out. And as part of any type of faculty development session, when you are working over 8 weeks with a highly engaged group of faculty, you want to see whether they've learned. We talked a lot about individual components of the case-based learning sessions, pre-work, the individual readiness assessment test, the components and how you use Zoom and engage your small groups on Zoom. So we decided to have a final exam, let's say, in a faculty showcase format. And we asked them to create their own 10-minute session using some of the features learned via Zoom, the polling, the whiteboard, if you could embed a video, a discussion period. And we had some really interesting and engaging topics. We talked about why eggs are oval and what creates the shape of an egg and the various theories surrounding that. We learned a lot about how women lead differently than men. There was pre-work, there was polling, there was discussion. One of the most interesting series was what's the best way to hang toilet paper, from the front or from the back? And while this seems like a kind of out of their topic, it was very engaging and incredibly well done. We reviewed the rules of the road for bicycle riders using polling and question and answers and features that one needed to know about helmet wearing, about the bike lanes, and about things to keep yourself safe on the roads in Miami. And our final session was how to play blackjack. Again, another very engaging session, very different take on the use of some of the different technologies that are available via Zoom. I would highly recommend this way of making sure your faculty understand the new technologies and really get them engaged so that they can create their own, even if it's for 5 to 10 minutes. It's a good way to get them to practice and to give them the really sense that they knew exactly what they needed to do when engaging with the students. So what worked? Using Zoom, as many of you know, has really allowed many more faculty to get engaged with this faculty development. They could be in their offices, they could be finishing up clinic, they could be at home, and yet log on to Zoom and be active participants in the Zoom session. It increased the number of faculty participating considerably. It improved the faculty's ability to understand how Zoom works, and we are able to record the sessions so that those sessions could be viewed later as a review for all faculty. We were able to, using our 360-degree approach, really build on concepts. Student-centered learning, classroom assessment techniques. We're constantly going back and reminding the faculty about these types of techniques and also utilizing them with each session. And we really familiarized our faculty with the learning paradigm that was really changing at the Miller School. And moving the students towards self-directed learning, we moved our faculty towards self-directed learning. And I think that was one of the things that was highly engaging, and really enabled the faculty to understand the benefits and also kind of the what's and the how's of the student-centered learning approach. So what did we learn and what did we take out of this for the next time and for the next steps in our faculty development? One of the things is that we had decided to have all faculty, regardless of role, participate in the faculty development sessions. It led to about 60 to 90 faculty at times participating in the weekly sessions, which overall is great, but if we had to do it again, we would have clustered the sessions specifically by the audience or the role that that faculty member was playing. Even though we sent specific invitations to individual faculty in those various roles that I had described, many of them showed up for all of the different sessions. So in the future, I think we need to cluster by role and make sure that those sessions are tailored to the individuals. Some of the sessions were too passive, and it's very difficult to not slip into the I can give you a lecture like I'm doing right now. To engage the faculty in active learning via an online platform is sometimes very difficult. And although there's various features we can use, we needed to teach those features first and then have the faculty incorporate those features into their future sessions. So we should have been more active, and we did receive that feedback from the faculty. We tried to mandate attendance, which, given what was going on in the COVID pandemic and the anxiety of the faculty, as well as the fact we are dealing with adult learners, I think encouraging the faculty to participate was a better way to approach it. The mandating of attendance was not well received. We quickly reversed course and just suggested that faculty show up and sent specific invitations to them each week to remind them of the topic of the session and the pre-work. And 8 weeks, while it seemed very long while we were doing it, was too short of a time to really be able to roll out and reinforce all of the different areas we needed to teach. The participants needed additional practice with the technology. We are continuing to do that, but although those sessions were recorded so that they could practice, they needed live sessions, and we needed to expand the timing and really extend the number of weeks that was available for the faculty development sessions. And while we had week 9 as part of our faculty development sessions, which was a real practice week, some of the faculty didn't participate and missed the opportunity to really engage more in depth with the technology. So we should have done more of that type of approach and had each faculty member maybe practice for a few minutes with each session on the various components. So something to be learned going forward. And at the end of the day, I think one of the most important lessons learned was during a time when many things are changing with the pandemic, with the rollout of the new curriculum, with different people in new roles. Getting the faculty together, even online, on a consistent basis was very important. And it was really well regarded as one of the highlights of the faculty development sessions. Our faculty need to engage with each other. They need to be able to voice their concerns. And as we became more and more familiar, even though we were a large group, people and each participant was more likely to voice a concern to the group, as the weeks went on, to become more engaged. And so setting up this type of approach to faculty development is a good one, and one that I would highly suggest. I want to thank you for listening today. Here are our email addresses if you have any questions. Edward Merced and David Lewis ran our Zoom and Blackboard sessions if you'd like to hear more about that. Marian Benitez Kaplan participated in developing all of the different approaches to online learning, and I'll be happy to engage with any one of you in terms of next steps for your own faculty development sessions. Thank you.